What's up, everybody? In today's video, we discuss some critical insights about a scorching topic, monkeypox. We will share the signs and symptoms and the means from where it spreads. So you should never miss this information-packed content. So, what is a monkeypox virus? Monkeypox is a zoonotic viral infection that can target both humans and animals. The term zoonotic refers to a disease that is being transferred in humans from animals. Or in other words, the disease is found in human colonies originating from animal gene mutations or zoonotic viral diseases. Types of monkeypox virus. There are primarily two known types of monkeypox till yet: 𝐬1 and 𝐬2, whereas 𝐬2 is milder than 1. Signs and symptoms. The signs and symptoms of monkeypox start appearing within 5 to 21 days after the viral DNA mutates the normal cell DNA. Let's understand this in the form of periods. The incubation period. It is the first period after every viral agent enters the body. The time span of this period is different for different viruses. In the case of monkeypox, it lasts from 6 to 13 days and mostly. A virus enters the body and replaces the cell with its DNA in this phase. In simple words, we can say that when a virus attacks the body cells, the viral DNA starts controlling the cells instead of human DNA. Thus the cells perform abnormally and produce disease. The incubation period is a quiet time. Viruses are present inside the body, but there is no visible symptom. In some cases, the cell remains in the incubation period throughout the disease, and the patient completely surpasses the disease without any symptoms. As we have experienced in COVID, many people had COVID antibodies in their blood. Still, they had no symptoms, and now in monkeypox, there are several cases reported in which the monkeypox virus was present in the blood cells. Still, patients were completely fine throughout the disease cycle and experienced no symptoms. This condition is not very dangerous for the patient itself because the absence of symptoms indicates that even if the virus is present inside the body, it does not control cell functions. But a patient can still be a carrier and can infect others. The disease starts if a virus passes the incubation period and takes body control. WHO has divided the disease phase of monkeypox into two periods: the invasion period and the eruption period. We will go through both of them separately. The invasion period. In the invasion period, few initial symptoms start appearing. Most are similar to measles, smallpox, chickenpox, or influenza, like intense fever, headache, back pain, sore throat, and severe muscle aches, also called myalgia. The patient may experience terrible energy loss. But an additional symptom in the invasion period occurs, which can distinguish between monkeypox and other similar diseases. And that is called lymphadenopathy, or in simple words, you can refer to swollen lymph nodes. It is a specialized character of monkeypox before the starting of the eruption period. Lymph nodes are present in different parts of the body, like in the neck, chest, groin, as well as abdomen. The most common swelling occurs in the neck lymph nodes just below the earlobes. But why do they swell? It is the body's natural feedback mechanism in response to the infections. The lymphatic system filters the body fluids. Suppose any toxic element or malignancy is found. In that case, the fluid aggravates inside the nodes and forms a small, soft yet painful lump that stays there until the infection is gone. The eruption period. After the invasion period ends, the body starts giving some clear warning signs for monkeypox infections. Usually, after 2 to 3 days of fever, different types of rashes appear on the skin. This is the onset of eruption. Experts at WHO say that the rashes concentrate more on the face than the trunk. The reason is still unknown, but in 95% of the cases, monkeypox rashes or blisters affected the face. In contrast, the hands and feet were affected in 75% of the cases. Similarly, the oral regions were targeted in 70% of the cases, and genitals were affected in almost 50%. The rash timeline. The rash of monkeypox evolves as the disease enters the next phases. Firstly, they are superficial lesions with a flat surface. Then, they become hard with slightly raised surfaces called papules. A few days with papules and a transparent fluid is filled in them, which turns yellowish with time, forming abscesses. In the healing stages, the crusty layer of fluid-filled pustules falls off, and the fluid also dries, leaving a dark spot on the skin. Severity and complications. Once a person gets infected, it can last inside the body for 2 to 4 weeks. However, the severity of the disease depends upon various factors like age, immunity, exposure to the virus, and the nature of complications. The fatality ratio in the current wave is between 3 to 6%. The complications of the monkeypox infection involve secondary disease risks like severe pneumonia, blood poisoning, or vision loss if the blisters appear on the cornea. In pregnant females, the virus can affect fetal health or even cause stillbirth in extreme cases. Transmission. Since this disease is zoonotic, humans can be infected if an infected animal bites or scratches them. Similarly, the butchers who prepare the meat can quickly transfer it to their bodies because they are in direct contact with animal body fluids and lesion substances. And once it affects the human-to-human transmission is straightforward and rapid. And the first affected are family members and the hospital staff. From one human to another, the virus spreads through airborne respiratory particles or other body fluids during pregnancy. It can pass on from mother to fetus and during intimate contact. A recent study published in a journal called The Lancet experts calculated the viral DNA from semen samples. However, it is not sure that they are also present in the vaginal fluids. The same study states that in Europe, most monkeypox transmission was due to male-to-male sexual contact, also called gayism. Another research discovered that monkeypox could transmit from one person to another via fomites, and the most prominent cause is contaminated bedding. So, sharing the same bedroom or utensils like blades, razors, spoons, plates, makeup items like lipsticks and glosses, and other objects that are directly in touch with body fluids can be a potential cause of transmission. Care and treatment. For care, both of the two modes of transmission have to be regulated. Either it's human-to-human or animal-to-human transmission. Human-to-human transmission risk. To reduce the risk factor for the human-to-human transmission, close physical contact with an infected or suspected person must be avoided. As the medical staff is at frontline risk, who directs the worldwide medical authorities to provide safety kits to the doctors, nurses, and helpers. Similarly, those healthcare workers who are sent to take specimens from the infected folks should use proper antiviral precautions to avoid any consequences. On an additional note, WHO states that those healthcare workers vaccinated against smallpox in childhood should be sent for specimen collection. Because recent studies and surveys are indicating that those individuals who had a vaccination course against smallpox are at low risk, because they have pretty similar antibodies present in their blood which are required against monkeypox. So it is a chance that their immune system can limit the viral activity more effectively. On the other hand, after specimen collection, the samples should be sent in double-sealed, medically safe containers to avoid disease expansion as much as possible. Similarly, WHO directs that intimacy activities should be regulated in a very disciplined way. Make sure to get checked and tested before going on to physical contact with your partner. Animal-to-human transmission risk. To control the zoonotic expansion or animal-to-human transmission, communities need to limit the unprotected interaction with wild animals, especially diseased or dead. Those animals used for food should be appropriately screened and cross-checked before eating. Animal husbandry experts at WHO suggest that the countries infected with monkeypox should immediately stop exporting animals like rodents, monkeys, and bats. Similarly, safe countries should also avoid the importation of such carrier animals. Vaccine. Now let's talk about the vaccine, as we all know that the only legit solution to a viral outbreak is a vaccine. Well, there is no official vaccine administered by the authorities against monkeypox as of now. However, as explained before, the folks who were vaccinated against smallpox and chickenpox in their childhood are at a lower level of potential risk. However, it still depends upon the age and immunity of an individual at the time of attack. Monkeypox tends to harm the seniles and juveniles the most because of the low immunity in the early and later ages of life. Kids below 5 and oldest above 50 are at 50% more risk than others. However, young people can still be the carriers, so quarantine is a must if anybody is experiencing the symptoms. That was it from today's video. Guys, I hope this video has cleared many of your concepts about monkeypox. If you found it helpful, then consider subscribing to the channel. Share this video with your friends and family. If you wish to join our community, you can follow us on Instagram. Display the handle on the screen. The link will be in the description below. With that said, stay safe, and we will catch you in the next one.